Dr. Timothy Peters, and I'd like to answer a few questions for you today about LASIK, and simply start with what is LASIK? LASIK is actually an acronym. It stands for Laser Assisted In Situ Keratomelusis. That means changing the shape of the cornea in the middle with a laser. There are two steps to really doing LASIK. LASIK is a process where the first step is creating a partial thickness flap in the cornea, and the second step is reshaping the middle layer of the cornea, called the stroma, to achieve the visual results we desire. There are different ways of creating the LASIK flap. You can create it mechanically with a device called a microkeratome. You can create it with a femtosecond laser. Or you can eliminate the flap completely and just simply do what's called a surface treatment, where you remove the top layer of epithelium, thereby accessing the middle layer. We do perform all three treatments, and we'll go over the differences now. Mechanical microkeratomes use a device that I use, my Bausch & Lomb, called a microkeratome, to create a partial thickness flap in the cornea. I've used this 10,000 times probably, and is very safe and successful, especially in eyes that are of normal shape, normal thickness, normal exposure. And we do mechanical microkeratomes all the time, and if one of your friends or family member had LASIK 5, 10, 15 years ago, they definitely had the creation with the mechanical microkeratome. Femtosecond lasers are the newest way of creating flaps. A femtosecond laser creates a partial thickness flap in the cornea similar to the way a microkeratome does, but it does it without a blade. It does it with using a laser. A femtosecond is a measure of time. It is 1/1,000,000th of a billionth of a second, so it's an extremely short amount of time. And by using this laser in that very short amount of time, it creates enough energy to create a bubble in the cornea. And you use these bubbles to create that partial thickness LASIK flap so that you can access the middle layer. We use the one by a group called Zemer. It's called the Leonardo da Vinci femtosecond laser. You may have heard of the Intralase femtosecond laser. There are a couple of other kinds as well, and they all do the same process of creating that partial thickness flap. We use it in certain groups of patients who really need the benefits of a very precise femtosecond flap creation. Patients who are slightly older, or whose corneas are thinner, or who have some dry eyes, or some shape or thickness abnormalities. You can also simply just wipe off the skin on the surface layer, and that's called a surface treatment, and we do that as well when need be. Once you've accessed the middle of the cornea, then you need to reshape the cornea, and you can do that one of two ways, either with traditional LASIK or with custom LASIK. Traditional LASIK treats two things, that is nearsightedness or farsightedness and astigmatism. It treats all prescriptions that are the same way, so that if you and I had an identical prescription, we would get an identical treatment pattern. And we do traditional treatments on people who have small pupils and normal prescriptions and low amounts of astigmatism, and it works quite well for them. Custom treatments, or wavefront guided treatments, are the second choice. And what this does is uses a wavefront machine to measure these subtle abnormalities in your eye and treat them as well as treating the nearsightedness and the astigmatism. We do these treatments on people with large pupils who have night vision issues or thin corneas or high prescriptions, because the results have shown a better quality of vision afterwards and better contrast sensitivity. And we'll be happy to go over these choices with you on an individual basis and guide you towards the flap creation and corneal reshaping method that's best for you.
Ask the Expert is brought to you by Clear Advantage Vision Correction Center in Portsmouth, on the web at clearadvantagelaser.com.